Hi, my name is Jessica. I'm a pediatric occupational therapist, and I'm here to share some tips and strategies as your children return back to school. One of the things that occupational therapists work on are fine motor skills. So this relates to pencil grasp and handwriting in your kids. One of the things that you can look for is if your child is still holding a pencil like this past the age of 3, that is something that you can come to an occupational therapist with, and we can evaluate that and help your child develop that skill. Another thing is utensil use. So if you're noticing that they're struggling to scoop with a spoon and maintain the food on top of the spoon all the way to mouth, or a fork as well, that's another skill that OT can help strategize for. Another thing that occupational therapists work on is frustration tolerance and impulse control. So after your child comes home from school, if they're having difficulties maintaining attention to their homework, they're getting frustrated or impulsively grabbing things, that's something that OTs can step in with and help develop those skills as well. Another thing that we help with is bilateral coordination. So using those two hands at one time, bringing our hands together at midline, this is the midline of your body, and also crossing midline. So bringing our right to left and our left to right. This relates to things like catching a ball, so maybe during recess or during time outside, you're noticing that they're struggling to keep up with the other children. And lastly, we also help with visual perceptual skills. So an example of this is if your child is able to recognize letters and shapes when they're flipped upside down and sideways. So if you're noticing any of these concerns with your child, please feel free to reach out to an occupational therapist. Thank you.